Why do you want to study medicine?
Because it's good.
This question is going to be asked in most, if not all, of your medicine interviews, so it's so important that you guys know how to answer it. In this video, I'm going to explain how to answer this question and what exactly are the interviewers looking for in your answer. Oh yeah, my name is Taha Butt and I'm a 4th year medical student, and I create funny, informative and fire content every Tuesday, so support me by subscribing, or else. Transition. Structure. Different interviews vary in time and style of questioning. Some may only give you 2 minutes to answer this question, whereas others may give you a whole 5 to 6 minute station for this question. And some interviews may interrupt you and discuss your points, whereas other interviewers, they may let you speak for the whole 5 to 6 minutes. Keep that in mind, as you may have to adapt your structure to the interview. But in general, I would recommend you have 2 to 3 points for why medicine in your answer that you can reflect upon. Make your answer about 5 to 6 minutes and have your strongest reasons or strongest points at the start, just in case the interviewer interrupts you. Having 2 to 3 reasons for why you want to study medicine shows the interviewer that you have thought this through thoroughly, and also will diversify your answer, therefore increasing the quality of your answer. Also, when you give a point, for example, you want to study medicine because of the problem-solving aspect, equip your answer with an example and a reflection. Don't just stop at, I want to study medicine because of the problem-solving aspect. Say, one reason I would love to become a doctor is due to the problem-solving aspect that the job entails. During my work experience at the GP, I saw that the doctor was exposed to many different patients with many different complex problems. One minute they were talking to an elderly patient with blood in their bowel, and then the next minute they were completing an examination on a 6-week-old baby. They had to call upon their scientific and communication skills to deduce what relevant investigations, referrals, and managements that the patients may have needed. Although this problem-solving aspect of being a doctor makes the job challenging, I think it is also that which makes working as a doctor intellectually stimulating and exciting, which is something I really admire. Quick fire tips. Be genuine, make it personal and specific. You know, some people may try and tell you that talking about personal events is just cliche, but for those people, yeah, I got a present for you guys. 1 second, it's in my pocket.
Shush.
If talking about a specific event that happened in your life that inspired you to want to become a doctor, if that is cliche, then the whole thing is cliche. You're cliche, I'm cliche, we're all cliche. Including personal life events is really gonna increase the credibility of your answer and really affirm to that interviewer that you want to become a doctor and study medicine. Prepare. Not preparing or thinking about your answers is gonna lead to your answer just being the go to football. Mercy. You want to finish and really explore the points in your answer. And not only that, but you have to think that the interviewer, they're not a mind reader. They don't know what's in your noggin. Planning your answer ensures that all the amazing ideas that you have in your head are articulated to that interviewer, thus increasing the quality of your answer and increasing your chances of getting into medical school. Be concise. Saying a lot with few words is vital for your medical school interviews because you only get a limited amount of time to answer your questions. And trust me, from someone who's done all 4 of their medical school interviews, after each and every one of them, I always thought, wow, that went so quick. And even after one of them, I couldn't believe that it was already over. Furthermore, linking this in with preparing your answer will help you to be concise because you can just cut out all the waffle that you'd normally say if you didn't prepare. Without being OTT, be enthusiastic. In your answer to why medicine, you really want to use phrases like, I would love to, or I really admire, or I was fascinated by. These little phrases let the interviewer know that this is someone who actually wants to study medicine, and that is a big thing that the interviewers are looking for. Examples of reasons you could use to why you want to study medicine. This can be a hospital incident that you or your family member was involved in. As long as you feel comfortable talking about it, you can reflect upon how the doctor inspired you through their reassurance and empathy that they showed you at a time you felt very hopeless. Or when they showed that they had a great scientific knowledge through when they used the information that you as the patient gave them to formulate a care plan for you or your family member. Being able to have a massive direct impact, making the job fulfilling and rewarding. Again, reflect upon a specific experience where you have seen a doctor have a massive impact on a patient. That could be when a GP switched some medications for a patient that was experiencing very severe side effects, or when a doctor at the hospital administered some important treatment to a patient to which the patient was really grateful for afterwards. Interested in science. With this, you can reflect upon how studying biology at school, or even better, By doing your own reading or attending lectures in human sciences, you can talk about how you were fascinated by all the intricacies of the human body, and that at medical school, you have the pleasure of learning about that for 5 years. And that is something you'd really love to do. Show your understanding of the realities of the job. Displaying that you understand the hardships of a doctor within your answer to why medicine portrays yourself as mature. You can briefly explain, despite the fact that being a doctor comes with a lot of stresses and difficulties, you still want to become a doctor, and then that will show the interviewer how much you really want it. You may obtain many of the attributes that a good doctor must have. As well as being inspired or loving an aspect of the job, another reason why you may want to study medicine is that you feel you're very well suited for the job. Obviously, disclaim that you have so much more to learn, but you could talk about one of your skills such as empathy, teamwork skills, or resilience, and how you would love to become a doctor because you feel like you could do a great job. And that in itself is rewarding and fulfilling as well. To conclude, point, example, and then explain or reflect. Prepare your answer and be honest. Being honest is important because you're gonna come across more genuine, and that's something that the interviewers are looking for. Someone who wants to study medicine and someone who has the right qualities for the job. That being said, don't feel like you can just wing your answer to why medicine because you've been told that you have to be honest and that has to come from the heart. No, prepare your answer so you can get all your amazing ideas out to the interviewer and to prevent your answer from becoming a double stack waffle ice cream sandwich. Just don't make it sound robotic and rehearsed. Try and sound a bit natural. Change your tone of your voice. Just be yourself, and you guys will do great. Check out all my other banging videos on interviews. And also, I do offer one-to-one mentoring for medical school interviews, as well as online mocks for only £20 an hour.
Wow, what a steal.
So if you're interested, then drop me a message on IG or email me. Links in the description below. And yeah, thank you guys so much for watching. Hope you guys benefited. Subscribe for videos every Taha Tuesdays. And peace.